What's up, everyone? It's David Warren. Welcome back to another video. I am a little late on posting this, but here we are. If you're new to this channel, consider subscribing, give this video a like, and I want to talk to you today about nurse practitioner versus physician assistant. What's the difference? What are the benefits? What are the cons? And which you should do. I want you to stay tuned to the end of this video, and I'm going to tell you my advice and what I would suggest to somebody wanting to do either program. I am in Alaska right now. I'm working here for about a month before I head back to Texas to start my full-time job at the 1st of July. It's currently the middle of June. It is the best time to come to Alaska. If you ever consider coming to Alaska, come in the summer, come in June. It's perfect. There's about 23 hours of daylight. It never really gets dark. It gets kind of like this, you know, just a little hazy. And it's kind of rainy today, but overall it's a really pretty day. It's 52 degrees, much better than the 100 degrees that I'm gonna go back to whenever I get back to Texas. So anyway, we're going to jump right into talking about nurse practitioner versus physician assistant. So I'm going to start with the PA programs. So I get asked this question all the time by people that I work with, by people emailing me, what's the difference between a nurse practitioner and a physician assistant? And this is the video. We're going to talk about it today. So I want you to know that I'm a nurse practitioner, not a PA, not an expert at PA education. I'm not an expert at all things PA, but I will say that I've worked with a lot of PAs over the years. A lot of them are my very good friends. And so I know a little bit about how they function, and I obviously know how a nurse practitioner functions because that's what I do. So let's talk about PA first. So to be a physician assistant, it is a master's degree program. There used to be some bachelor's degrees. I think most of those have kind of phased out now, and they're just master's programs, kind of like a nurse practitioner program. To enter into a PA program, you're going to need a bachelor's degree, from what I can tell. I think there are some programs that will accept just credit hours. You know, you've taken all your prerequisite courses, but ultimately you're going to need a bachelor's degree to go into a PA program. And it kind of varies as to what you're going to need your bachelor's degree in. Some people get it in biology, chemistry, some people get it in psychology. However, there are prerequisite programs that you have to take, prerequisite courses that you have to take before you can get into PA school. So you're going to need to take like biology, chemistry, organic chemistry, microbiology, anatomy and physiology. But all of that's going to be, I guess, specific to the program that you want to apply to. So if you're interested in PA programs, look up their prerequisite requirements because they're going to be different for each program. Most PA programs require that you have some form of healthcare experience, whether it be like being a nursing assistant or, you know, some kind of shadow experience, something that has allowed you to see how healthcare works in the United States. And preferably you're shadowing a PA or a doctor or a nurse practitioner, somebody in healthcare that you can get some insight as to how you know, a PA would function in the clinical setting. Apart from that, most PA programs require an interview. So once you apply, you'll either be invited to interview, and you'll go before a panel, and they'll ask you questions about being admitted into their program. You're also probably going to have to take the GRE, so the Graduate Record Exam. It's an entrance exam into most graduate degree programs. Some PA programs don't require that, but I would say the majority do. So be prepared to take the GRE. Once you are into a PA program, you're going to be doing didactic and clinical hours. And so your didactic hours are probably going to be the first year. Usually it's a 2-year program. And then your clinical hours are going to be the subsequent year. And then after you graduate from your PA program, you're going to have to take a national certification exam. However, during your PA program, you're going to have about 2,000 clinical hours. 2,000 clinical hours. That's a whole lot of clinical hours. And then after you graduate, you'll take your certification exam. And then after about 10 years, you have to recertify. I think it used to be every 5 years. Now it's every 10 years. You have to retake the exam and pass it to maintain your national certification. And I don't know what I think about that. That's good, I guess, but there are varying thoughts on that. One thing about the PA programs is that they are trained in all specialties. So as a PA, they do rotations in family medicine, emergency medicine, general surgery, OBGYN, all of the kind of core specialties that physicians train in. PAs train in that same thing. So when you graduate from PA school, you can practice in whatever area you want. You can go to general surgery, and then you can go to psychiatry, and then you can go to emergency medicine. There's just so many different areas that you can practice in as a PA. And that's one of the big time pros of being a PA, is that you have one certification, one license, you practice anywhere you want. And for those of you who are nurses or are nurse practitioners, you know that's not the case for a nurse practitioner. And we'll get into that later. That's a little bit of a soapbox of mine. But that's one of the downfalls of being a nurse practitioner. However, being a PA, yeah, you get to practice whatever area you want. You can switch specialties, and it's just, I think it's better. So we'll just leave it at that. However, I guess kind of one of the downsides, I guess it depends on how you view it. PAs will always be supervised, and so they're always in a supervisory role, not in a supervisory role, they are being supervised. I don't know what the proper terminology for that is, meaning they always have a supervising physician, a physician that they're working with that will sign off on their cases. Nurse practitioners don't always have that. It depends on the state, and so some states will require you to have a supervising physician. Some states will require that you don't, that you have independent practice. So that's a little bit about what the PA education model looks like. PAs are trained in medicine, whereas nurse practitioners are trained in advanced practice nursing. So a little bit of that overlaps, but not a significant amount. Okay, now on to nurse practitioner. Something I can actually talk about and know about. All right, so nurse practitioners are masters or doctorally prepared advanced practice nurses, meaning that they hold an advanced degree. So again, some master's degrees, some doctoral degrees, a DNP, Doctor of Nursing Practice. First, you have to have your bachelor's degree. So you have to have a BSN, Bachelor of Science in Nursing. Most programs require that you work as a nurse for a year or two. There are some programs that you don't have to work. However, I think that work experience gives you just hands-on patient experience and lets you kind of get your hands wet, kind of realize what you're in for. And then when you apply to graduate school, some graduate programs require prerequisite courses. So some may require chemistry, anatomy and physiology, microbiology. A lot of that you will have taken in the BSN program or prerequisite to your BSN program. But some of those courses will be required. And then once you're into the program, it is usually 2 years. If it's a doctoral program, it can be 3 to 4 years. You're going to spend the first year doing didactic classwork, the second year doing clinical. If you're in a doctoral program, usually the first 2 years doing didactic classwork, wiping out some of those doctoral classes, and then going on to your clinical courses. However, a big thing before you go to nurse practitioner school, you're gonna have to choose a certification. So this is a huge difference between NPs and PAs. So to be a nurse practitioner, you have to choose a specialty, meaning family nurse practitioner, acute care nurse practitioner, pediatric nurse practitioner, psychiatric nurse practitioner, and unfortunately that's your scope of practice. So once you get into one of those programs, family nurse practitioner, you're really stuck in doing primary care or minor urgent care, or if you go into acute care, you're stuck doing internal medicine, you're stuck being a hospitalist, being a critical care nurse practitioner. That's a downfall, I think. You have some lateral mobility, meaning you can move around, but your scope is limited. So I'll give you an example. If you go be a family nurse practitioner, you're stuck in primary care. You can't go work in the ICU. It's outside your scope of practice. That's kind of as simple as that. So that's the downfall to being a nurse practitioner, is you're just so limited in your scope of practice without going back and choosing an additional specialty. So PAs have the huge win there. one big there. They can go work in whatever area they want without getting a new license or a new certification. Nurse practitioners also have about 500 hours of clinical hours to do. So compared to the 2,000 clinical hours that PAs do, nurse practitioners have it pretty easy. Going through school, 500 clinical hours max to get their national certification and to get their license. So that's significantly less than any PA program you'll run across. And so some of the argument is PAs are trained better than nurse practitioners because they're experienced. They experience more clinical hours in their program of study. Some will say, oh, it doesn't matter. Nurse practitioners have been nurses for X amount of years. I don't think being a nurse helps you to become a nurse practitioner. It helps in the fact that you've seen patients and you put your hand on a patient, but you're not making the decisions as a nurse. You're not calling the shots. You're not writing the orders. So I don't think that really matters. I think two things for nurse practitioner programs. First, they need to require more clinical hours. Second, there needs to be some sort of standardized certification so you're not going back and getting all these additional certifications and licenses, and it's just a headache. Your scope of practice is just limited when you're a nurse practitioner. Not a bad thing. If you know you want to do primary care, you know you want to do acute care, you know you want to do psych, then you're set. But if you're like me and you're so scatterbrained that you don't know what you want to do, it's not a good combination. So, however, after you graduate, after you take your national certification as a nurse practitioner, then you can, you're a nurse practitioner for good. You don't have to renew your certification by means of exam. You can renew your certification by doing continuing education and paying the certifying body to renew it. You don't have to retest. So once you test once, you're good. You're golden. You don't have to do it again. And that is a huge benefit, because I do not want to take my national certification exam again. That would be a disaster. I thought it was hard the first time. I know it'd be hard again, especially if you're working in like general surgery and you're having to take these boards that a new grad would take, kind of boards that cover things across the lifespan. And, that's challenging. So NPs have the win there. Okay, here's what I think. Here's my advice. If I had it to do over again, I would probably go to a PA school. Honestly, I'd go to PA school for these reasons. Like I said, the lateral mobility. As a PA, you can work in any specialty, anywhere. You don't have to have additional licenses. You have one license, a PA license. As a nurse practitioner, if you want to work different areas, you got to have different certifications. You got to have your family and your acute care and your psych and this and that. And it's just alphabet soup after your name. And if I had it to do over again, I wanted to do medicine and I didn't want to go to medical school, I would go to PA school. So that's my advice to you. That kind of hurts me to say it, but go to PA school. I think that's probably the better option at this point. I will say this: nurse practitioners aren't as respected as they should be because of that very reason, because they don't have enough clinical hours. A lot of their programs are online versus PA programs are in class or brick and mortar. So yeah, I'd go to PA school. That'd be my advice. Anyway, comment below. Let me know what your thoughts are about it. I am really interested to hear some of the points that I made, what your responses to that would be. If you're a PA or if you're an NP, or if you're thinking about going to PA or NP school, let me know what you think. I want to hear it. Thanks for watching, and I'll see you next time.